Martha Paynter is an author, a registered nurse as well, who provides abortion care. She is in Halifax. And Martha, of course, abortion is it's a legal medical procedure in Canada, but access does depend on where you live. And so tell us, for example, the challenges for women in the Maritimes.
We talk about patients and use gender-inclusive language, pregnant people, and we've made some major inroads since 2015 in the Maritimes with the introduction of self-referral in both New Brunswick and Nova Scotia and the opening of a comprehensive clinic in PEI. So there's been really tremendous gains in terms of access, not to mention the fact that medication abortion was approved by Health Canada in 2015 and now makes up between 30 to 50% of the abortion care through primary care offices. So while there are, of course, always challenges for people living in poverty, experiencing gender violence, threatened by racism within the healthcare system, we have made tremendous gains that people should know about.
The Prime Minister on Friday said, and this is a quote, "I want women in Canada to know that we will always stand up for your right to choose." When it comes to access to abortion, concretely, are there things the government should be doing?
Absolutely. That government is overdue for fulfilling their promise for pharmacare. If we had public funding for contraception, that would be a tremendously important element of reproductive health care. Also, this government could revoke the charitable status of the hundreds and hundreds of crisis pregnancy centers that distribute misinformation and terrorize patients.
How do you think the ruling in the United States will affect discussion about abortion here in Canada?
We're always worried that our patients will be misinformed and not know how to get care. So this is a time to be very vocal about how abortion really works here. And it's also a time for more people to join, in particular in primary care, to take mifepristone prescribing into their practice, to expand access. And we're also always worried about escalating anti-choice extremist rhetoric and how that might affect our patients' confidence. So we want patients to rest assured that as providers, we are here for them. Abortion care is normal, safe, common, and they will be well cared for by providers in Canada.
Tonight on the program, we're obviously talking about abortion now in Canada, access to abortion, and in the future, but we also want to look back in terms of history as well. And so when I say Dr. Henry Morgentaler to you, what comes to mind?
Henry Morgentaler's 1988 ruling really was the moment when decriminalization in Canada happened. And until the recent decriminalization in New Zealand, Canada was alone in the world for having that status of care, that abortion is health. It's a health service. It's not legal or illegal. It's just healthcare like antibiotics or a knee replacement. And that really, his leadership for decades, from the 60s through to his death in 2013, he made, it was formidable work, and we're all very grateful for it. I personally volunteered at his clinics and for his legal defense fund in New Brunswick. So he's a hero to us all.
Martha Paynter, thank you very much for speaking to us tonight.
My pleasure.